Hello everyone. Welcome again to our another topic for our psychiatric nursing. For this time, we tackled about addictions. But before we proceed to our discussions, we need to know the learning objectives of our discussion for today. Number one, learning outcomes natin that is explain the trends in substance abuse and discuss the need for related prevention programs. We also discussed the characteristics, the risk factors, family dynamics, uh, prevalent with substance use disorder. And also we need to describe the principles of 12-step treatment approach for substance use disorder. And then apply the nursing process to care of the clients with substance use issues. Provide educations to clients, the families, and communities member to increase the knowledge under the understanding of the substance abuse, and also discuss the nurse's role in dealing with the chemically impaired professional. And lastly, we need to evaluate our feelings, our attitudes, and responses to clients and families with substance use disorder. Okay, let's start with the substance abuse. Okay, when we say substance abuse, that is already national health problems, and that is the actual prevalence of substance abuse difficult to determine. So substance abuse is a disorder, and a related disorder as a national health problems. More than 16.6 million adults Americans and 697,000 adolescents ages 12 to 17 years have an alcohol use disorder. So of adults age 18 years and older, 14% report that binge drinking in the past month. So other statistic, it said that nearly 88,000 people die from alcohol-related causes each year. Okay, so what are the detrimental effects of the substance abuse? Number one, we have the alcohol-related death is the third leading preventable cause of death in the United States, and also absenteeism at work, prenatal exposures, and we have the increased violence. That is the detrimental effects of the substance abuse. And now there are different categories of the drugs. So many substances can be used and abused. Some can be obtained legally, while the others are illegal. So this discussions includes the alcohol and prescriptions, medications as substance that can be abused. So abuse of more than one substance, the term there is polysubstance abuse. So these are the categories of drugs includes. We have the alcohol, the sedatives, hypnotics and anxiolytics, stimulants, cannabis, opioids, hallucinogens, and inhalants. Okay, so on these discussions, describe the specific symptoms of intoxications, overdoses, the withdrawal and detoxification for each above mentioned substance category. Okay, we have the diagnostic classes of the substance abuse. So these are the important terms that we need to understand. We have the intoxications, withdrawal syndrome, detoxifications, the substance abuse, the substance dependence, and then the substance use. In intoxications, that is the use of a substance that result in maladaptive behavior. While withdrawal syndrome, that is refers to the negative physiological and physical reaction that occurs when use of a substance ceases or dramatically decreases. And the detoxifications, that is the process of safely withdrawing from a substance. So the treatment of other substance induced disorders such as the psychosis, the mood disorder is discussed in depth in the separate chapters so that we will understand clearly about that case. In substance abuse can be defined as using a drug in a way that is consistent with the medical or social norm and despite of the negative consequences. So in substance abuse denotes the problems in our socials, vocationals, or legal areas of the person's life. So while the substance abuse uh, or the substance dependence also includes on the associated addictions as the tolerance, the withdrawal, and unsuccessful attempts to stop using the substance. So these distinctions between abuse and dependence is frequently viewed as an unclear and unnecessary because the distinction does not affect the clinical decisions once withdrawal or detoxification has been completed. Hence, the term substance abuse and substance dependence or chemical dependence can be used interchangeably. Okay, the term abuse or the substance abuse or substance use is used to include both abuse and dependence. It's not meant to refer for occasional or one-time use. Let's proceed to the onset and the clinical course on the substance abuse. So, the number one there in the United States, the average of age for an initial alcohol intoxication episode is the adolescents. And then, however, in the early course of alcoholism, typically begins much earlier, with the first episode of intoxications between the ages of 12 to 14 years. So that is the first evidence of the minor alcohol-related problem is seen in the late teens. And also the episode of sipping as early as 8 years old. So the pattern of more severe difficulties for people with alcoholism begin to emerge in the mid 20s and mid 30s. These difficulties can be the alcohol-related breakup of significant relationship, an arrest of public intoxication or driving while intoxicated, evidence of alcohol withdrawal, early alcohol-related health problems, or significant interference with functioning at work or schools. During this time, the person experiences his or her first blackouts. When we say blackout, that is an episode during which the person continues to function but has no conscious awareness of his or her behavior at that time or any later memory of the behavior. And then, as the person continues to drink, he or she often develops a tolerance for alcohol. That is, he or she needs more alcohol to produce the same effect. So after continued heavy drinking, the person experiences the tolerance break, which means that very small amounts of alcohol intoxicates the person. So the latter course of alcoholism, when the person's functioning is definitely affected, is often characterized by periods of abstinence or temporary controlled drinking. Okay, so yung abstinence natin may occur after some legal or social or interpersonal crisis, and persons may then set up rules in drinking only beer. So this period of temporarily controlled drinking. Okay? So, this period of temporary controlled drinking soon leads to escalations of alcohol intake, more problems and subsequent crises, and then the cycle repeats itself or repeat continuously. For many, substance use is a chronic illness. So many people, substance use is characterized by remissions and relapses to former level of use. So yung relapses natin rates, it's about the 60 to 90% with nearly of the half of the individual. Okay, and then we have the minority of people remain so sober after the first treatment of experiences. So the highest rates of for successful recovery is the abstinence and the high level of motivations. And we have the spontaneous remissions. When we say spontaneous remissions, that is a natural recovery that that is a quick drinking on their own without a treatment program. So, nagkakaroon tayo ng poor outcome associated with earlier age onsets. Longer period of a substance use and the coexistence of a major psychiatric illness also, which extended use, there is of mental and physical deteriorations. So, and infections, diseases. So, yun. Okay, these are the related disorder. We have the gambling disorder, caffeine and tobacco addictions. Substance can induce symptoms similar to other mental illness diagnosis. So in a gambling disorder, that is a non-substance related diagnosis that is characterized by problem gambling, spending money. One cannot afford to lose, lying about gambling, getting money from others, and an ability to refrain from gambling for any specific time. So there is an attempt to quit or cut down the result in a restless and anxious and irritable behavior. In a caffeine and tobacco, or nicotine are substances that are addicted and are included in the Diagnostic Statistical Manual of our mental disorders. So this has also been discussion of the possible addictions to the internet, noting the same people or some people spend more than a half of their waking hours on the computer and become upset and irritable if their use is limited or curtailed. So, yon. So, the study will determine whether or not they will be treated as a new type of addictions. And then we have the substance can induce symptoms that are similar to other mental illnesses uh, diagnosis, such as the anxiety or the psychosis or the mood disorder. So the symptoms may be subside once the substance is eliminated from the body. So this is not always the case. So these are the related disorder uh, for our substance abuse. Let's proceed to the etiology. We have the biologic factors, we have the psychological factors, and we have the social and environmental factors. Let's proceed to the biologic factor. In the children of alcoholic parents are higher risk for developing the alcoholism and drug dependence that are children of non-alcoholic patients. So this increase the risk is partly the result of environmental factors, but evidence points to the results of environmental factors, the importance of the genetic factors as well. So yon. In the genetic vulnerability, several studies of twins have shown the higher rate of concordance among identical than fraternal twins. Adoption studies have shown higher rates of alcoholism in sons of biologic father with alcoholism than in those of non-alcoholic biologic fathers. Okay, in the neurochemical influences, on a substance use pattern have been studied primarily in an animal research. So the ingestion of mood altering the substance stimulate the dopamine pathways in the limbic system, which is produces pleasant feelings or high that is reinforcing or positive or experience. Okay, so distributions of the substance throughout the brain alters the balance of our neurotransmitter that modulate pleasure, pain, and reward responses. Okay? Next one, we have the psychological factors. In addition to our genetic links to alcoholism, family dynamics is taught to play part. So children of alcoholics are 4 times as likely to develop alcoholism compared with the general population. So some theories believe that inconsistency in the parents' behavior, poor role modeling, and lack of nurturing paved the way for the child to adopt the similar style of maladaptive coping, stormy relationship, and substance abuse. Okay? And then some people use alcohol as their coping mechanisms or to relieve stress and tension. So their increase of power, decrease psychological pain. So the highest doses of alcohol, however, actually increases the muscle tensions and nervousness. In social and environmental factors, cultural factors, social attitudes, peer behavior, law and cost and availability of all influence, initials, and continued use of substances. Okay, that is the carry less social disapproval such as the alcohol and cannabis, which older people use drugs such as cocaine and opioids that are costlier and rate higher disapproval. So alcohol consumption increases in areas where availability and decreases in areas where costs of alcohol are higher because of the increased taxation. Uh, let's proceed to the cultural considerations. In the attitudes vary in the different cultures. So, for example, the attitudes towards substance use, the pattern use, and the physiological differences to substance vary in the different culture. For example, yung Muslim do not drink alcohol. Okay? Wine is an integral part naman in the part of the Jewish religious rites. And then we have in the some Native American tribes naman use peyote or hallucinogen in the religious ceremonies. So mayroon tayong pagkakaiba in regarding in beliefs when assessing the substance abuse as a problems. And then certain ethnic groups have genetic traits predispose them to or to protect them from developing alcoholism. For instance, flushing, a reddening of the face and neck as a result of increased blood flow has been linked to variants of genes of enzymes involved in the metabolism. Okay. And also, we have the variations in enzymatic activities among Asians, uh, Americans, and whites. And we have the alcohol abuse. In the alcohol abuse is a part in the 5 leading causes of death for Native Americans and Alaska Natives. And 1/8 of the Native Americans identified as needing treatment for alcohol or drugs. In Japan naman, alcohol not regarded as a drug. While in Russia, there is a high rate of alcohol abuse, suicides, and cigarette smoking in male populations. We have number one, we have the alcohol. Sa alcohol, we have the intoxications and overdose. So alcohol is the central nervous system depressant that is absorbed rapidly into the bloodstream. So initially, the effect of the relaxations and loss of inhibitions. With the intoxications, nagkakaroon po tayo ng slurred speech, unsteady gait, a lack of coordinations, impaired attentions, memory, and we have the judgments. Some people become aggressive or display inappropriate sexual behavior when intoxicated. The person who intoxicated may experience blackouts. An overdose or excessive alcohol intake in a short period can result in vomiting, unconsciousness, respiratory depression. So this combination can cause aspirations, pneumonia, or pulmonary obstructions. So alcohol-induced hypotension can lead to cardiovascular shock and death. So the treatment of the alcohol overdose is similar to that for any central nervous system depressant. So, ang pwede natin gawin ditong treatment for the overdose, we have the gastric lavage or dialysis. Dialysis to remove the drug and support of the respiratory and cardiovascular functioning in an intensive care unit. Okay, next we have the withdrawal. Sa withdrawal natin, the symptoms of withdrawal usually begins within 4 to 12 hours after the cessation or mark of reductions of the alcohol intake. So symptoms includes the coarse hand tremor, sweating, elevated pulse, blood pressures, insomnia, and anxiety. So there is also a severe of untreated withdrawal. May progress to the transient hallucination, seizure, or delirium tremens. So alcohol withdrawal usually peaks on the second day and is over about 5 days. This can be very, however, and withdrawal may take 1 to 2 weeks. Okay, withdrawal can be life-threatening because of the detoxification need to be accomplished under the medical supervisions. If the client withdrawal symptoms are mild, he or she can abstain from alcohol, or she or he can be treated safely at home. So, for more severe withdrawal or client who cannot abstain during the detoxifications, a short admissions of 3 to 5 days is the most common setting. So, there are also in the some psychiatric clinics, units also admitted clients detoxifications, but this is less common. So, ang safe natin dito, that is benzodiazepines for our safe withdrawal. So, when we say safe withdrawal is usually accomplished with the administration of benzodiazepine, such as ano yung mga benzodiazepine natin. Meron tayong lorazepam, which is the Ativan, we have the Librium, we have the Valium. So, this one is to suppress the withdrawal symptoms. So, withdrawal can be accomplished by fixed schedule dosing, known as tapering, or symptom-triggered dosing, in which the presence and severity of the withdrawal symptom determine the amount of medications needed and the frequency of administrations. Okay, question number 1. Is the following statement true or false? Alcohol is a central nervous system stimulant. What's your answer? The answer is false because alcohol is classified as a central nervous system depressant. Next one, we have the sedative, hypnotics, and anxiolytics. Okay. So, yung kanina, yung alcohol ang pinag-usapan natin. Ngayon naman, yung sedatives, hypnotics, and anxiolytics. So, yung intoxication and overdose includes the central nervous system depressant. Okay? So, example, barbiturate, non-barbiturate hypnotics, and anxiolytics, particularly the benzodiazepine. So, benzodiazepine and barbiturate are the most frequently abused drug in this category. Okay, so there is also the intensity of the effect depends on the particular drugs. Okay, so nagkakaroon tayo ng CNS depressant. Sabi ko nga, there is an intensity depend on the drugs. Yung intoxication symptoms natin, the slurred speech, lack of coordinations, unsteady gaits, labile mood, stopper. Okay. So, and the barbiturate overdose, possibly lethal. So, magkakaroon siya ng coma, respiratory arrest, cardiac failure, and deaths. So, yon. So, yun yung usually na makikita natin. So, these are the intoxication symptoms. So, ang benzodiazepine, when taking orally is in overdose, are really fatal, but the person is lethargic and confused. Okay? So, treatment includes gastric lavage followed by the ingestions of activated charcoal and saline cathartic. So, the onset of the withdrawal dependent on the half-life of the drugs, but there is a symptoms opposite of the drug's acute effect. And then there is also the detoxifications via drug tapering. Okay? We have the stimulants. Sa stimulants natin, that is drugs that stimulates or excites the central nervous system and have limited clinical use. So there is with the exemption of stimulants used to treat attention deficit, hyperactivity disorder, okay, and a high potential for abuse. So yon. So intoxications and overdose, there is a high or euphoric feeling, hyperactivity, hypervigilance, anger, elevated blood pressure, chest pain, confusions, seizures, and coma with the overdose. Okay? Intoxications from stimulant develops rapidly. So there is an effect doon sa ating bagay na iyon. So, in the withdrawal from the stimulants occurs within a few hours to several days after cessations of drug and is not life-threatening. So, ikokwan natin. That is the onset within the hour to several days. So, the primary symptoms mark as dysphoria. So, it's the primary symptoms and accompanied by fatigue, vivid and unpleasant dreams, insomnia or hypersomnia, increased appetite, and psychomotor retardation or agitations. Meron din tayong tinatawag na crashing. In the crashing, that is a marked withdrawal symptoms, that is the person may experience depressive symptoms, including the suicidal agitations for several years or several days. So the stimulant withdrawal is not treated pharmacologically. Let's proceed to cannabis or our marijuana. So the cannabis sativa, this is the hemp plant that is widely cultivated for its fiber used to make rope and cloth for oil from its seeds. So it has become widely known for its psychoactive resin. So the resin contains more than 60 substances that is called the cannabinoids. Okay? So marijuana refers to the upper leaves, flowering tops, and stem of the plants. Okay, so the legal status of cannabis that is changed in the United States. Okay, so basta yung cannabis and marijuana natin that is used for psychoactive effects and there is a medical applications. In the intoxications, nagkakaroon lang siya lowered inhibitions, relaxations, euphoria, increased appetite. And also the symptoms of intoxications includes the impaired motor control, impaired judgments, and there is a delirium. The cannabis is a psychotic disorder, and there will be no overdose. dose. So there is no clinically significant withdrawal symptoms. So there is only a possible of symptoms of insomnia, sweating, anxiety, and tremors. So yun lang po pagdating sa cannabis or marijuana. We have the opioids. When we say opioids, that is a popular drugs of use because they desensitize the user to both physiological and psychological pain and induce a sense of euphoria, euphoria and well-being. So there is desensitization to pain, euphoria, and well-being. So opioid compounds include both potent prescriptions and analgesic. Okay? So sa intoxication natin, there is an apathy, lethargy, listenlessness, impaired judgment, psychomotor, retardations or agitations, constricted pupils, drowsiness, slurred speech, and impaired attentions and memory. So nagkakaroon din tayo ng overdose. Kapag nagkaroon ng overdose of cannabis, there will be a coma, respiratory depressions, pupil constrictions, unconsciousness, and death. So that is for naloxone. We have the withdrawal so in opioids. So in opioids withdrawal develops when drug intake ceases or decreases markedly, or it can be precipitated by the administration of opioid antagonists. So the initial symptoms of these are the following. So nagkakaroon siya ng nausea, vomiting, dysphoria, lacrimations, rhinorrhea, sweating, diarrhea, yawning, fever, and insomnia. So yan yung ating mga initials symptoms. Symptoms of opioid withdrawal cause significant distress, but do not require pharmacologic interventions to support the life and bodily functions. Okay, so there will be short-acting drugs, and then we have the long-acting drugs. In the short-acting drugs, for example, which is the heroin, so ang onset lang niya ng mga anak, that is 6 to 24 hours. And the peaking in 2 to 3 days and gradually subsiding 5 to 7 days. And the long-acting drugs, which is the methadone, the onset here is 2 to 4 days and subsiding within 2 weeks. In hallucinogen, that are the substances that distort the user perceptions of reality and produce symptoms similar to psychosis. So includes the hallucinations. Okay, that is usually visual and the personalizations. Okay, so hallucinogens also cause the increase of the pulse, the blood pressures, and the temperature. There are also a dilated pupils and hyperreflexia. So, example of hallucinogens are the mescaline, psilocybin, lysergic, and acid dithylamines, and designer drugs such as ecstasy. So, kapag nagkaroon ng intoxications, there will be a maladaptive behavior and psychological changes, and also there will be an anxiety, depressions, and paranoid ideations. So, medications are used to control the seizures and the blood pressures, and there will be a cooling devices such as hyperthermia and blood pressures. So, in cooling devices such as hyperthermia, blankets are used and mechanical ventilation is used as a support for the respirations. There, kapag nagkaroon tayo ng overdose, toxin reaction ay primarily psychological. Okay. So, no withdrawal syndrome that has been identified for hallucinogens. So, some people have reported a craving for the drugs. So, yung hallucinogens natin can produce the flashback, which are the transient recurrences or perpetual disturbances like those experiences with hallucinogen use. So, this episode occur even after all the traces of the hallucinogens are gone and may persist for a few months up to 5 years. So yung ating toxicity, we have the seizure, the hypertensions, and then the hyperthermia. So here in the hallucinogen, there is a medication to control the seizure and the blood pressures. And also there will be cooling devices, and there will be also a mechanical ventilations. So there is no withdrawal syndrome. So some report craving for the drug lang. And then there will be a flashback possible for a few months up to 5 years. Next one, we have inhalants. Yung inhalants natin, okay? So yung inhalants na tinatawag natin, when we say inhalants are the diverse group of drugs that include anesthetic, nitrates, and organic solvents that are inhaled for their effects. So the most common substance in this category are aliphatic and aromatic hydrocarbons found in the gasoline, glue, paint thinner, and spray paint. So there is a less frequently used the halogenated hydrocarbons includes the cleaners, correction fluids, spray, can propellants, and other compounds contain esters, ketones, and glycols. So, ang intoxication natin, there will be a neurologic and behavioral symptoms. So, yung inhalant intoxications natin involves the dizziness, nystagmus, lack of coordinations, slurred speech, unsteady gaits, tremor, muscle weakness, and blurred visions. So, yan yung usually na symptoms. And usually, there is a stupor and coma can occur. So, nagkakaroon siya ng acute toxicity. Okay? And then, there is no withdrawal or detoxification because frequent user report also for cravings. And then, there is a symptomatic treatment to this related disorder. Questions. Is the statement true or false? A person who abuses hallucinogens will experience withdrawal syndrome and cessations of use. So the answer is false. There is no withdrawal syndrome associated with hallucinogen use. Okay. Punta naman po tayo sa substance abuse treatments. In the substance abuse treatment, there will be a current treatment modalities based on the concept of alcoholism. So, as medical illness that is progressive and chronic and characterized by remissions and relapses. So, today, there will be a treatment of substance used and available in variety of community setting. So, not all which involve the health professionals. So, meron tayong 12-step programs for our Alcoholic Anonymous. So, Alcoholic Anonymous that is founded in the 1930s for the alcoholics. So dito sa ating 12-step program Alcoholics, that is based on the philosophy that total abstinence is essentials and that alcoholics need the help and support of others to maintain the sobriety. So you can see the 12-step of Alcoholic Anonymous on your books in chapter 19. Okay? There also have the individual group counseling. Sa individual and group counseling natin, there will be a regular attendance at meetings is emphasized. So meeting are very available daily in the large cities and there is a least weekly in smaller town or rural areas. So the program here is on the client being treated for intoxications and withdrawal detoxification are encountered the variety of medical settings from emergency departments to our outpatients clinics. So, yun yung makikita natin. So, kapag ganyan, nagkakaroon tayo ng yung ating yung ating health professionals provide extended and outpatient treatment in various settings, including our clinics or centers offering the day and evening programs. So generally, the treatment settings selected is based on the client's need as well as his insurance coverage. Okay? So yun yung ating isipin. And then we have the pharmacologic treatment. So pharmacologic treatment substance has two main purpose. Yung main purpose natin is to permit safe withdrawal from alcohol, sedative hypnotics, and benzodiazepine. And yung number two naman natin is to prevent the relapse. To prevent the relapse, so yun yung kailangan natin. So nagkakaroon tayo ng pharmacologic treatment natin, ang tatandaan natin the safe withdrawal and then the prevent relapses. So medications help manage withdrawal or cravings but not a specific treatment for our substance abuse. Okay? So usually mga anak, ang sinosubscribe nila dito, that is the disulfiram or Antabuse, prescribed to help deter the clients from drinking. So meron din yung ating acamprosate or Campral, may be prescribed for clients recovering from alcohol abuse or dependence to help reduce cravings for alcohol and decrease the physical and emotional discomfort that to our patients. So, ang dual diagnosis natin dyan, that is substance abuse plus another psychiatric illness. And then, estimated 50% of people with substance abuse disorder also have the mental diagnosis. Okay, so yung mga mahilig uminom dyan, let's see to it na nakakaya natin. Sabi ko nga palagi, ilagay sa tiyan, wag ilagay sa ulo. Because, ulitin natin, in the double diagnosis, that is clients who have schizophrenia, schizoaffective disorder, or bipolar disorder presents the greatest challenge to healthcare professionals. So sabi ko, there will be a 50% people with substance abuse also have the mental diagnosis. Okay, successful treatment. Yung successful treatment natin, there will be a relapse preventions strategies. So magkakaroon tayo ng nursing care plan. So yung nursing care plan natin, kasi hindi po, for example, there will be an ineffective coping. So doon, kailangan po natin ng healthy, nurturing, supported living environment, help with the fundamentals life changes such as finding jobs, abstinent friends, connection with other recovering people, and treatment of comorbid functions. So yun yung ating isipin in terms of the successful treatment. Okay, in the substance abuse, and there is nursing applications in our nursing process. Siyempre, start tayo in the assessment. Sa assessment, tingnan natin yung history. So usually yung history that is chaotic family life, there is a family history or crisis that precipitated about the treatment. And then general appearance and motor appearance and motor behavior is important to assess. Yung kanilang mood and affect, usually they are tearful, expressing guilt, remorse, angry, sullen, quiet, and unwilling to talk. In their thought process and content, there is a minimized substance use, and then mahilig sila sa pamimintang or blaming others and rationalization. Mahilig silang mag-rason. Okay? So, and the sensorium and intellectual process, clients generally oriented and alert unless they are experiencing lingering effects of the withdrawal. So, intellectual abilities are intact unless clients have experienced the neurologic deficit from long-term alcohol use or inhalants use. Okay? For the sensorium and intellectual process. Punta naman tayo sa judgment and insight. Clients usually likely to have exercised the poor judgment. So, especially while they are under the influence of substance, judgment may be still affected. So client may behave impossibly, such as leaving treatment to obtain the substance of choice. Okay? And then in the self-concept, generally have low self-esteem, which they may express directly or cover with grandiose behavior. And the roles and relationship experience many difficulties with social, family, and occupational roles. So nagkakaroon ng absenteeism and poor work performance are very common here in the substance abuse. In the psychological considerations, many clients have histories of poor nutrition and sleep disturbances. So they may have liver damage from drinking alcohol, HIV infections from IV drug use, or lung or neurologic damage from using the inhalants. In our data analysis and nursing diagnosis, each client has nursing diagnosis specific to his or her physical health status. So this includes, pwede po natin yung imbalanced nutrition less than the body requirements, risk for infections, risk for injury, diarrhea, ano pa, excessive fluid volume and activity intolerance, and self-care deficit. So usually the nursing diagnosis commonly used when working with clients with substance use. We have the ineffective denial, ineffective role performance, dysfunctional family processes, alcoholism, and ineffective coping. So usually there will be a related physical health status and related to substance to use. In outcome identifications, the treatment outcome for our clients with substance abuse use many includes, so abstain, number one yan, from alcohol and drug use, express the feelings openly and directly, accept the responsibility for own behavior, practice the non-chemical coping alternatives, and establish an effective aftercare plan. So yan yung dapat makita natin sa ating substance abuse. Questions. Is the following statement true or false? A client who abuses substances will commonly state that he or she can control his or her use of the substance. What is the answer? The answer is true. Typically, the client is a denial and commonly states that he or she can stop using the drug anytime. Okay, so ang intervention natin, importante ito sa ating substance abuse. In the interventions for our substance abuse, it really helps to providing the health teaching for the clients and the family. So the clients and family needs fact about the substance and its effect and recovery. So the nurse must dispel the following myths and misconceptions regarding for the substance abuse. So pwede po nating sabihin about substance abuse is an illness, dispel myths about the substance abuse, and then abstinence from substance is not a matter of willpower. Any alcohol, whether beer, wine, or liquor, can be abused substance. So prescribed medications can be an abused substance also. Feedback from the family about relapse signs, for example, a return to previous maladaptive coping mechanism is vital. And then continue the participation in aftercare program, it is important. So educations about the relapse is very important. Family members and friends should be aware that the clients who begin to revert to old behavior, return to substance using acquaintances, or believe they can handle myself now are the high risk for the relapse, and loved ones need to take action. So whether a client plans to attend a self-help group or other resources, a specific plan for continued support and involvement after the treatment increases the client's chances for recovery. So that is the first one, the health teaching for the clients and the family. Next one, we have the addressing the family issues. We have the codependence, shifting roles. Pag sinabi po natin kasi codependence, that is a maladaptive coping pattern on the part of the family members or the others resulting from a prolonged relationship with the person who uses the substances. So usually the characteristic of the codependents are poor relationship skills, excessive anxiety and worry, compulsive behavior, and resistance to change. So yun yun. Pag sinabi naman po natin the shifting roles, in the shifting roles, that is role may be shifted grammatically, such as when a child actually look out for a take care of the parents. So co-independent behavior have also been identified in healthcare professionals when they make excuses for client behavior or to do things for clients that clients can do for themselves. And then last one, we have the coping skills. In the promoting of the coping skills, nurses should be encouraged the clients to identify the problems in their lives and to explore the ways that substance use may have intensified these problems. So our clients should not believe that all life's problem will disappear with sobriety. Rather than sobriety will assist them in thinking about the problems clearly. Okay. And then we have the evaluation. Sa evaluation naman natin, usually, the effectiveness of the substance abuse treatment is based on heavily clients abstinent from the substance. In addition, our successful treatment should result more stable role performance, improve the interpersonal relationship, and increase satisfactions with the quality of life. Okay? Our elder consideration, approximately there will be a 30 to 60 elders in treatment began drinking abusively after age of 60. And there is a risk factor for the late onset substance, include the chronic illness that causes the pain, ang long-term use of prescription medications, that is sedative, hypnotic, or anxiolytics, like stress, social isolations, grief, depressions, and abundance of discretionary time and money. And then also there is a problem in the physical problem associated with substance abuse develop rather quickly. Okay, community-based care. In many people are receiving treatment for substance abuse, do so in a community-based setting. So for our outpatients, treatment, freestanding substance abuse, treatment for the facilities, recovery program, which is the AA and rational recovery. And then we have the agency-sponsored aftercare program, individual or family counseling, and clinic or our physician's office. So, others aftercare program session is sponsored by the agency where they can complete the treatment. So, makakatulong yon sa kanila. And lastly, we have the mental health promotions. We have the public awareness and educational advertisings, early identifications of older adults with alcoholisms, and then the college drinking prevention program. So a person only has to watch televisions or read magazines to see many advertisements targeted at promotion of responsible drinking or encouraging the parents to be anti-drug influence for their children. So increasing the public awareness and educational advertising have not made any significant change in the rate of substance abuse. Okay, in the late onset of the alcoholism in older adults is usually milder and more amenable to treatment, yet healthcare professionals overlook it more frequently. In the college drinking prevention program, which is government sponsored, is response to some following statistic about the college student between the ages 18 to 24. Substance abuse and health professionals. So the physicians, dentists, and nurses have far higher rates of dependence on the controlled substance, such as opioids, stimulants, and sedatives that other professionals of comparable educational achievements, such as lawyers. So one reason is thought to be ease to obtaining controlled substance. Healthcare professionals also have the higher rates of alcoholism rather than the general population. So there will be an ethical and legal responsibility to report suspicious behavior to our supervisor. There will be a general warning sign, which is poor work performance, frequent absenteeism, unusual behavior or slurred speech, isolations from peers, and there is a specific behavior. So these are the general warning signs. Okay, so there are also specific behavior and signs that might indicate substance abuse includes incorrect drug counts, excessive controlled substance listed as wasted or contaminated. There will also report by clients of ineffective pain relief from medications. So damage or torn packaging. So unexplained absences from the unit. So yon ang makikita natin. So self-awareness lang tayo issues. The nurse must examine his or her beliefs and attitude about the substance abuse. So, a history of substance use in a nurse's family can influence strongly on his or her interactions with the client. So, the nurse may be overly harsh and critical, telling the nurse or telling the client he or she should realize how you hurting your family. So, we need to examine our own beliefs about the alcohol and drugs. We need also the history of substance abuse and recognize that substance abuse is chronic illness with the relapses and remissions and should be remain open and objective. So yan po yun. And then points to consider when working with clients and families with substance abuse. Remember, mga anak, that substance abuse is a chronic, recurrent disease for many people, just like the diabetes or heart disease. Even so, our clients look like they should be able to control their substance abuse easily. They cannot without assistance and understanding. Another one, examine the substance abuse problems in your own family and friends. Even so, it may be painful. Recognizing your own backgrounds, beliefs, and attitudes is the first step toward managing those feelings effectively so that do not interfere with the care of our clients and families. And lastly, we need to approach each treatment experience with an open and objective attitudes. So the client may be successful in maintaining abstinence after his or her or third treatment experience. So that's for our topic for today, addictions. Thank you.